25 minutes before 11 o'clock. You know, one way to get paranoid about your health is to watch a lot of health shows or to read a lot of things on the internet. I had a doctor prescribe for me a supplement, and I think it was called L-arginine. It was for the veins in my legs. And you know, it's unusual for a doctor to prescribe supplements. I don't even know if the word prescribe is right. But anyway, long story short is I noticed I would eat and I would feel so bloated, and I wasn't even putting two and two together. I didn't think it was the supplement. It never even occurred to me. I thought something was really wrong with me, you know. Anyway, it turned out, long story short, it was just the supplement. But if there is something wrong with your digestion and you're noticing it, then the best thing to do is make sure you get it checked out. Dr. Phillip Hart is on the phone. Dr. Hart is an assistant professor of medicine in the Division of Gastroenterology, Hepatology, and Nutrition at The Ohio State University and the medical director of The Ohio State University Section of Pancreatic Disorders, speaking to us, just a real short interview this morning on Exocrine Pancreatic Insufficiency. And let's find out what that is and what it feels like. Good morning, Dr. Hart. How are you?
Hi, Larry. Thanks for having me on the show.
You're welcome. And where are you, in Ohio right now?
Nope, we're in New York City here.
Either way, you're getting cold weather. I saw it on the Weather Channel.
Okay.
You might want to come to Florida. I don't know. So I don't know if you heard during the introduction that what do you call a supplement actually was causing me to wonder if something was wrong, and then it turned out it was nothing big deal. But yeah, anything like that, we should go to our doctors and make sure that there isn't something wrong, right?
You know, Larry, the symptoms that you're describing are very common, and in fact, it's estimated that about 60 to 70 million people in the United States have some type of digestive symptom. These would be things like bloating, like you had mentioned, but other things such as gas or a change in their stool pattern.
And we can scare ourselves, so I don't want to do that to anybody, but at the same time, if you catch something early, the message consistently is to get it early, and then there'll be no big problem.
That's right. The American Gastroenterological Association recently conducted a survey, and it was estimated that patients waited around 4 years to discuss their symptoms with their healthcare provider. And this is, we feel, unnecessary in terms of the delay. Unfortunately, the most common reason that patients cited for having a difficult time discussing this with their healthcare providers was due to embarrassment.
Really? Okay. I guess I can see that if it's stool related. Nobody wants to talk about that. The one thing I think for me was that I just simply thought, oh, this will go away. I must have been something I ate. And it was something I ate in my case, but it was something I was taking without realizing it was causing it.
No, you're right. And your perception is right on, too. That was another common response that patients provided in terms of reasons that they hesitated to share their symptoms with their healthcare providers.
How about the people that all of a sudden they have to like go to the bathroom right away, and no matter where they're at, and sometimes they can't make it to the bathroom? Is this part of it also?
Yeah, you're right. So the excuse me, the medical term for that is fecal urgency, and you're right. That is another of these common GI symptoms. One of the reasons that the AGA set about doing this survey was to really explore EPI, which is one of the possible causes of these types of symptoms that we're discussing here. And specifically, we wanted to look into this further because this is something that can be easily treated, and so patients are unnecessarily suffering from these symptoms.
So, and EPI stands for?
EPI stands for Exocrine Pancreatic Insufficiency, and in brief, this just describes the situation where the pancreas doesn't make enough digestive chemicals to accomplish the normal digestive function of the pancreas in response to food.
Okay, does it mean there's something malfunctioning in the pancreas?
That's correct. EPI happens as the secondary result of some other underlying disease with the pancreas, such as pancreatitis, or pancreas cancer, or cystic fibrosis.
Oh my gosh! And one of the cancer words sounds serious.
Mm-hmm.
That's right. Now, one of the challenges, though, is that these symptoms can be very nonspecific and overlap substantially with other common GI conditions. And so, this is one of the reasons that we really encourage patients or any of your listeners that are suffering from these symptoms to discuss these things rather than waiting with their healthcare providers to help understand if there may be some other alarm symptoms going on that might indicate that further evaluation would be needed.
Is it age specific? In other words, if you have a child complaining about a bellyache or something like that, could it be this, or is this something that is most likely in an older person?
So EPI is a condition that can happen at any age and in any gender.
Can it be inherited?
There are a small number of diseases of the pancreas, such as chronic pancreatitis or cystic fibrosis, which can be inherited. And so if children have one of those conditions, then they are at risk for developing EPI, yes.
Sometimes people like to get treated with acupuncture. Does acupuncture provide a relief, or should they go to their primary physician?
So for EPI, the only treatment that's shown to be effective is to use prescription-based medical supplements that are referred to as pancreatic enzymes. As far as I'm aware, there are not any convincing studies regarding acupuncture or other complementary or alternative therapies that are helpful in this specific complication of pancreas diseases.
So some of the symptoms I was reading about sound similar to what they tell you could be caused by gluten, and so I'm imagining we were talking about why people don't go to the doctor. They might be diagnosing themselves incorrectly.
Mm-hmm.
Yeah, you're correct. So with EPI in its most severe form, the symptoms are more specific in that patients tend to have greasy stools or unexplained weight loss. But in those patients with mild EPI, the symptoms of abdominal bloating and gas can overlap with a variety of other GI conditions. You mentioned celiac disease, but also things such as lactose intolerance or irritable bowel syndrome. And so we do feel that it's important for patients to discuss these symptoms in more detail with their healthcare providers.
Yeah.
So with the holidays coming up and everything, there is a variety of food and drink offerings out there. People should really understand what's going on with their symptoms before they partake in anything, because that could be pretty embarrassing.
That's right. Although for most patients, even before the Thanksgiving holiday, they've been able to identify food triggers, which can be avoided.
So let's try to wrap it up and give information. I wanted just real quickly, if you could just explain again, what would be a symptom that might be a red flag for somebody? So
the symptoms that should be red flags of severe EPI would be the development of greasy stools or weight loss that can't be explained by another condition. The symptoms related to the milder forms of EPI would be things like abdominal bloating or gas. But when we're thinking about whether or not a patient may have EPI, it's also important to consider their risk factors for pancreas disease. So whether or not they either personally or someone in their family has had pancreatitis, or whether they have other lifestyle factors that would place them at increased risk for developing a pancreas disease.
The one thing that you mentioned about being embarrassed, I'm guessing that every doctor hears everything, so there's probably nothing that they haven't heard. So embarrassment, while it's something you just have to kind of grin and bear, your doctor probably couldn't care less. It's probably just part of his routine day. Or her routine day. I don't mean to indicate no lady doctors. I have a wonderful lady doctor. My doctor's a lady. All right, so Exocrine Pancreatic Insufficiency, also known as EPI. Do you have a website you can direct us to?
Sure, yeah. For anybody interested in learning more, they can go to identifyepi.com as well as gastro.org.
Okay, identifyepi.com and gastro.org. Thank you, Dr. Phillip Hart. Thank you for being on the air with us today.
All right. Thanks, Larry and Robin.
We will be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. On this Tuesday, partly sunny and quite nice with a high of 80 to 80.